Well, aside from questions of political ideology, there's a certain path dependence in terms of the way European countries have evolved in their treatment of health insurance coverage and the way the U.S. has evolved. Over time, as healthcare technology has diffused and has continued to make the healthcare industry such an important part of our economy, it's obviously become harder and harder to challenge the status quo. And a policy like this, as we saw this year, has the potential to upset many important stakeholders. And you can imagine 30, 40 years ago when some European countries made important strides in expanding coverage to their populations, the stakeholders in the healthcare technology industry, the stakeholders in the health insurance technology in those countries were not as significant political forces as they are here and have been for decades. And so only now, with the passage of the current legislation, was there enough urgency among the stakeholders who previously really held up legislation that some compromise was possible. I think only because what was perceived as the coming crisis of the uninsured and the confluence of a number of issues. So I think it's hard to look at a single issue as being critical here. But in fact, if one looks at European countries and the health insurance coverage of those countries, there's not a monolithic answer that has been put forward in Europe, and those systems have evolved and over the decades become more and more universal. Many of them, like our system, started as employer-based systems and have added pieces, much like this legislation, which achieves coverage through a variety of elements, although the individual mandate piece of the U.S. legislation, I think, makes it somewhat unique in the way that it's being implemented.